He was 74 years old, perfect health record. Walked 3 miles every morning. The cardiologist said it was routine. Just a stress test, he said. We do dozens every day. By midnight, half his face wouldn't move. I'm Dr. Fine, and what I'm about to tell you could save your life, or the life of someone you love. Because right now, in medical offices across the country, seniors are being wheeled into routine procedures that their bodies were never meant to handle. The test that nearly killed my patient? It's performed 8 million times a year on Americans over 65. And most doctors won't tell you the truth about what happens when aging arteries meet modern medicine's aggressive protocols. Before we continue, I'd like to remind you that this channel is like a family. We don't just share information, we share stories. So, as you watch this video, feel free to comment. If something I say reminds you of a moment, a challenge, a health scare, or even a memory that brought you joy or frustration, please share it. Your experience might help someone else. Here's what they don't want you to know. Your blood vessels at 70 aren't the same as they were at 40. They're like antique rubber bands, still functional, but brittle. Push them too hard, too fast, and they don't stretch. They snap. The test I'm warning you about? The nuclear stress test. Specifically, the chemically induced version where they inject drugs to force your heart to race while you lie perfectly still. Think about that for a moment. Your body is at rest, but your heart is sprinting a marathon. It's like flooring the gas pedal while the car's in park. Something's going to give. And in seniors, what gives is often a piece of plaque. A tiny fragment that's been sitting quietly in your carotid artery for decades. The sudden surge in blood pressure, from 120 to 200 in seconds, can launch that fragment like a bullet. Destination, your brain. I've seen it happen 3 times this year alone. 3 patients who walked in for a routine test and left with permanent damage. The youngest was 68, the oldest 81. All 3 were told the same thing. This is standard procedure. Standard for who? Not for the 78-year-old whose arteries have weathered 7 decades of life. Not for the woman on blood thinners whose vessels are already fragile as tissue paper. Not for anyone whose body has earned the right to gentle care, not aggressive intervention. You know what's terrifying? The medical establishment knows this. There are studies, buried in journals most doctors don't read, showing stroke risk increases 400% in the 48 hours after a chemically induced stress test in patients over 70. 400%. Yet they schedule these tests like oil changes, in and out. Next patient, please. Let me tell you about Margaret. 76 years old, sharp as a blade. She ran her own business until she was 72. Her doctor ordered a stress test because of some minor irregularities on her EKG. Dr. Fine, she told me later, I felt something pop in my head when they gave me that injection, like a rubber band snapping behind my eye. The technician told her it was normal anxiety. 12 hours later, she couldn't remember her granddaughter's name. Here's the truth bomb they won't drop. Most seniors don't need these aggressive tests. There are safer alternatives, gentler ways to assess your heart that don't involve chemical Russian roulette. But those alternatives take longer, cost more, require actual thinking instead of following a checklist. So they default to the dangerous option, the efficient one, the one that processes you like a product on an assembly line. Your life, their convenience. I'm going to share something that might save your life. Before any doctor suggests a stress test, ask these exact words. Given my age and medical history, what's my stroke risk in the 72 hours following this procedure? Watch their face. If they dismiss the question or say minimal, you're in the wrong office. A doctor who respects the aging body will pause. Think, maybe even pull up specific data about your risk factors. Those are the doctors who see you as a person, not a protocol. Before we go deeper, I want to hear from you. Have you or someone you love experienced a routine test that went wrong? Maybe you felt pressured into a procedure that didn't feel right? Your story matters. Share it below. We're building a community of wisdom here. Your experience could be the warning someone else needs to hear. Now let me blow your mind with something else. You know who rarely gets strokes after stress tests? Patients whose doctors take one simple precaution. They pre-treat with aspirin and adjust the chemical dose based on age. One pill, one dosage adjustment. That's the difference between walking out whole and leaving in a wheelchair. But here's the kicker. This isn't standard practice, it's considered extra, optional. Like senior safety is a luxury upgrade. You're not a car getting an oil change, you're a library of experiences, a vessel of stories. Your body has carried you through decades. It deserves protocols that honor that journey, not ones that treat it like a 30-year-old athlete. I had a patient last month, 79 years old, former engineer. His cardiologist wanted to run a nuclear stress test because of some chest discomfort. He asked my opinion. "Have you tried walking upstairs?" I asked. "Every day," he said. 2 flights, no problem." "Then you've already done a stress test," I told him. "A real-world one, your stairs don't lie." We did an echocardiogram instead. Found what we needed. No chemicals, no stroke risk, no midnight emergency. He sent me a photo last week, him and his grandson building a model airplane, both hands steady, both sides of his face smiling. That's what appropriate care looks like. But here's what really burns me. The medical system counts successful procedures, not successful lives. That stress test that triggered a stroke? If you survived, it's marked as successful in their records. Your permanent speech difficulty? Not their department. Your new tremor? Different specialist. Your fear of medical procedures? Psychological issue. They fragment your suffering to avoid accountability. You've been told to trust the white coat, to nod when they say routine, to assume that modern medicine always knows best. But modern medicine was designed for younger bodies, bodies that bounce back, bodies with elastic arteries and robust repair mechanisms. Your body has different wisdom, slower wisdom, the kind that whispers, "This doesn't feel right." Listen to that whisper, because here's a secret. The best doctors listen to it too. They know that after 70, aggressive isn't always better. Fast isn't always safe. And routine is a word that should raise red flags, not lower guards. I'm going to give you a protection protocol. Print this, carry it, share it. Before any test involving contrast dye, stimulants, or rapid blood pressure changes, ask, what happens if we wait 3 months? If the answer is nothing, then wait. Ask, is there a gentler alternative? There usually is. Ask, what's your plan if I have a stroke during this procedure? If they look surprised by the question, leave. You are not difficult for asking, you are not paranoid, you are informed. Remember Margaret, the one who felt the pop in her head? She's suing now, not for money, for change, for protocols that treat seniors like the treasures they are, not lab rats in a profit machine. She told me something last week that stopped me cold. Dr. Fine, I trusted them because I thought routine meant safe. Now I know it means profitable. Your heartbeat has kept time through wars and peace, through love and loss, through decades of American dreams and occasional nightmares. It deserves better than a chemical assault disguised as care. So here's my prescription. Question everything. Trust your gut. And remember, you've survived this long by being smart, not by being compliant. The next time someone in a white coat says routine stress test, you say, let's discuss alternatives. The next time they rush you toward a procedure, you say, I need time to think. The next time they treat your age like a weakness instead of a strength, you find a new doctor. Because you're not just aging, you're advocating for yourself, for others, for a medical system that sees wisdom, not just wrinkles. Hit subscribe, not just for information, but for protection. We're not just aging, we're awakening. And tomorrow, I'm exposing the blood pressure medication that's putting thousands of seniors in the hospital every month. The one your doctor probably prescribed last week. You've earned the right to the truth. All of it. No matter how uncomfortable it makes the medical establishment. This is Dr. Fine reminding you, your life is not routine. Neither should be your care. Stay wise, stay warned, stay alive.